Oh, AVR is positive in this one. You've misplaced the leads again. Let me teach you. So, you guys also learn. There are basically 12 conventional leads in an ECG divided into 6 of the frontal plane and 6 of the horizontal plane. The 6 leads of the horizontal plane are pretty simple, numbered from V1 to V6. Let's learn the placement of these. V1 is placed in the 4th intercostal space just to the right of the sternum. V2 in the same space just to the left of the sternum. V4 is in the 5th intercostal space at the mid-clavicular line. V3 is exactly between V2 and V4. V5 is placed in the 5th intercostal space and the anterior axillary line, and V6 in the same space in the mid-axillary line. Coming to the frontal plane leads, there are further of two types. The 3 standard leads, lead 1, 2 and 3, and the 3 unipolar leads, AVR, AVL and AVF. Lead 1 goes from the right arm to the left arm. Lead 2 goes from the right arm to the left leg, and lead 3 goes from the left arm to the left leg. Now, these are more than 15 centimeters away. So if these electrodes are connected to a single electrode, it will be of zero potential and it can be connected to the negative pole of the galvanometer, that is the ECG machine. Now if the positive electrode is kept on right arm, it will give a unipolar lead known as VR. Similarly, VL is for left arm and VF is for left foot. But these show very small deflection. So they are augmented and known as AVR, AVL and AVF. The AVR looks into the cavity of the heart, AVL looks at the lateral border and AVF looks at the inferior wall of the heart. Now, the orientation of these leads. Lead 1 and AVL represents the high lateral or the left lateral wall. Lead 2, 3 and AVF represent the inferior wall, and lead V1 to V4 represent anteroseptal wall. The V1 and V2 correspond to right ventricle roughly, and V3, V4, V5 and V6 correspond to the left ventricle. There is no particular leads for the posterior wall of the heart. Watch the next reel to learn about the basic deflections in an ECG and the mode of activation.